Again, welcome. This is the Health Services Q&A session. My name is Liz Chase, and I'm the Parent Supporter Orientation Coordinator. Absolutely delighted to have you folks with us this evening. And I'm going to let my colleagues introduce themselves.
All right, welcome. My name is Melissa Selby-Toit. I am a senior psychotherapist in the University Counseling Center, and I also serve as assistant director over our outreach and prevention programming, as well as a member of the faculty in the School of Social Work.
My name is Kristen Draper, and I am the team lead at the Metro Health Campus Health Center for Grand Valley. And I help oversee daily operations as well as patient care at the Allendale Metro Health as well as the Grand Valley campus.
Good evening. My name is Tina Barnico. I'm the Senior Director for Health at Grand Valley. I'm also a member of the Virus Action Team and the Return to Campus team.
Hi everyone, I'm Kate Harmon. I also joined Tina on the Virus Action Team and the Campus Readiness Team for fall. I'm also the Director of Recreation and Wellness, and I'm the liaison between GVSU and Metro Health for the Campus Health Center.
All right, well, before we begin, I did want to mention a couple of logistical items. The first is that I am recording this session this evening, and I will post this recording on our Parent and Supporter Orientation website early next week. So if you'd like to come back and view the session, that will be available. And I'll put the link to that website in the chat in just a moment. So how tonight is going to work is my colleagues are going to share a couple of brief PowerPoint slides, just highlighting some key information in their area, and then we'll open it up for your questions. So really the next 45 minutes, the majority of it will be dedicated to the questions that you have. So without further ado, I'm going to hand it over to my colleagues.
Okay, I'm ready. I'm going to share my screen here really quickly. And there we go. Okay, so we will chat first about the University Counseling Center. So just a couple quick facts about University Counseling Center services on campus. So the University Counseling Center has 23 licensed mental health clinicians. That includes a mix of psychologists, psychotherapists, as well as APA doctoral trainees and clinical social work trainees as well, with a broad range of experience and expertise. So in our center, we might provide treatment for anything from homesickness or difficulties with adjustment, all the way up to very serious mental health concerns that students may experience and mental health crises that may occur on campus. Services are available on both the Allendale and Grand Rapids campuses. So wherever your student may live or may attend classes primarily, we are able to provide services. In our center, which is pretty consistent with what we see at university and college counseling centers across the country, the top presenting concerns for which students seek treatment are anxiety, anxiety disorders, depression, interpersonal and other relationship-related concerns, and also trauma. Those usually round out our top four in terms of students in need of treatment. And then just a quick note about our services and the way our services work, should your student at any time be interested or in need of counseling support. So the way services work is that students, when they call the office, are initially scheduled for a screening appointment within 1 to 2 business days. So any student who calls our office and would like to speak with a clinician will be seen within 48 hours or two business days. That allows us to get folks in quickly, to assess what it is that's going on, and to work with them to determine the best course of action moving forward. So we don't want students having long wait times to get in with someone, which is why we work very hard to see them as quickly as possible. And so as we work with students and start to assess the concerns that they bring into that screening appointment, we help develop an action plan. And so that might include short-term individual counseling, which we do offer through the center. That's time limited. Group counseling. Group counseling is our kind of long-term therapy option. Group counseling sessions are unlimited and students can partake in them throughout the course of their time at the university. We do interpersonal process groups, identity-based groups, skills-based groups. There's some really exceptional groups to meet the needs of just about any student on campus. As we develop a plan with students, for some, it may include referral to a community provider, much like if you go to a general practitioner or your family physician. That family physician may not have the resources in office to treat every single health concern, like heart surgery or something like that, probably not done by a general practitioner. And so when we do have folks who come in who maybe have something that would work best or be treated best by a specialist in the community, we help support that student in finding referrals and making sure that they're connected with the services that they need. And we also offer a wide array of self-guided support resources. And so for some students who just need some skills or who need some information about what it is that's going on and how they might best tackle that, we can help connect students with those resources and check in with them to make sure that their needs are being met. Additional services that we offer. So in addition to the short-term clinical therapy, the group counseling, referral, and self-help resources, we also provide crisis response to the campus community. We provide consultation services. That is for faculty staff, of course, but it's also for students who may be concerned about another student. If they are concerned about the safety or well-being of anybody else on campus, a student can contact our office and one of our clinicians will meet with them and help them navigate that situation in a way that is healthy and safe for them and also healthy and safe for the student who they're concerned about. Consultation also extends to parents as well. So if you are concerned about your student or have questions about our services, you may always call in and ask. We are bound, of course, as healthcare providers by confidentiality, so we cannot provide information back to parents, but if a parent is concerned, they can always call our office and speak with one of our clinicians. We also offer online self-help materials. We offer career psychology services and career counseling services, alcohol and other drug prevention and treatment, as well as campus-wide mental health outreach and education. So we do mental health screenings across campus, we do presentations across campus, we do events across campus with the intention of teaching skills to our campus community to improve resilience and also ensuring that all students know that we exist and feel that the center is accessible to them when or if they're in need of mental health treatment services. And in addition to that, we provide a peer education program. So that is the University Counseling Center. I'm happy to answer any questions that you have at the end, and I will pass the torch to the Campus Health Center.
Metro Health. I am the team lead at the Metro Health Allendale and Grand Valley campus. Our Campus Health Center is conveniently on the corner of the campus on Pierce and 42nd Street across from the water tower. And we offer quality care for all GVSU students, faculty, and the staff. We accept all major insurances. And if the student does not have insurance, we do offer a 60% discount on all services. The student is the only fee that they're responsible for is their copay. So if their insurance requires a copay, we do ask the student that they pay that at the time of their service. If they, however, do not have that copay at time of service, we will bill that. And it's very important that the students bring a copy of their insurance card to their appointments so that we can put that in the record and bill out as appropriate. And you can find more information on the gvsu.edu/campus health website in regards to the Campus Health Center as well. The services, if you want to forward, yep, perfect. The services that we offer at the Campus Health Center. So we do allergy shots. So Typically with allergy shots, we ask that the students bring in their allergy serum and drop it off to the campus health center where we'll store it as appropriate. And then those students come in as required by their allergist on the frequency, and we give the doses. And if they're late on those doses, then we will actually call their allergist office to figure out which correct doses it should be on if they're late on those shots. We can also diagnose and treat any short-term illnesses and injuries. We will provide immunizations and vaccinations for students, which include your general vaccines. We have the COVID vaccine, TB tests, everything like that. We are able to do labs on patients. So if they are seeing one of our physicians, our staff will draw blood work on them, as well as any orders that they have from other providers. We will see them for that as well. We also have radiology services on site. So we will, if they come in for a sports related injury or maybe a possible cough and we need to do some imaging, we'll do that for them there as well. We have a doctor that is at the center that does the LGBTQIA healthcare. And that is a newer service to Metro, and it's been very popular. So we do everything from the transition to just general care, and we can offer counseling services if needed, as well as referring out if needed. We offer our physicals. So your it could be sports physicals, your general physical, all of that. So we do offer those. We can prescribe medications and order diagnostic tests if needed. We can also refer to physical therapy and necessary specialist visits as deemed by the provider. We do have a provider on site that does sports medicine. So she's very involved with Grand Valley and the athletic department on site. So she does attend football games or other sports that are involved with Grand Valley. And she does work at our Allendale office as well as the Grand Valley office. We also have sexual health, including STI screening. So we can do that on an as needed basis. And we also offer women's health services. So your basic gynecological exams, breast exams, pap smears, and just general women's health service. The campus health center or Grand Valley doesn't require insurance for domestic students, but it is strongly encouraged. For 2021 school year, students can enroll in a PPO health insurance with Shield. Most are
Kristen, I think we're losing your audio there.
Yeah, I can speak on the student health insurance. That Grand Valley doesn't require health insurance right now for domestic students. We did this past academic year and prior years, including this coming year, students can enroll in Blue Cross Blue Shield plan if they would like. That is an opt-in option, and on our website, you can certainly find out the cost for that. But this past year, for a annual coverage for Blue Cross Blue Shield, the rate was just under $1,800, and that included medical, prescription drugs, dental, and vision. We're still negotiating the rates for this coming academic year, but that's an option that some students certainly utilize. And the information to contact Relation Insurance Services to get more information is right there on that slide for you.
Okay, so as I stated before, my name is Tina Bronico and I'm the Senior Director for Health. And I'm going to touch on several topics this evening, primarily related to COVID. So around vaccines, testing, tracing, isolation, and quarantine. So Grand Valley is encouraging all members of our Laker community to be fully vaccinated for COVID-19 prior to coming to campus. So the term fully vaccinated simply means that it's been at least 2 weeks since the final vaccine in the series. So if it's the Johnson & Johnson vaccine, which is just one vaccine, it's 2 weeks after that one. If it's either Pfizer or Moderna, which are both 2 vaccine series, then it's 2 weeks after that second vaccine. that 2 weeks gives some time for that immunity to build up, so that before they come back onto campus where they may have an exposure, it's good to have that protection. Currently, based on the guidelines, individuals who are fully vaccinated, if they have an exposure, they are not required to quarantine unless they develop symptoms. So in addition to reducing the potential for disruption because somebody has to quarantine or, becomes positive and therefore has to isolate, higher vaccine rates within our entire population will allow us to transition back towards much more what we would maybe consider normal activities and experiences. So, classrooms that aren't socially distanced and being able to hang out with your friends, a whole bunch of friends at the same time in the commons room, or, going to student organizations and athletic events and all those things that we really either couldn't do this year or we had to do in these very socially distanced, masked environments. And so the fastest way for us to return is to really have a robust vaccine rate on campus. Since last summer, the university has administered a testing program. Testing is offered on campus, both for routine or asymptomatic, or you might hear the term surveillance testing. So these are people who come in, they routinely test. Maybe they're in a little bit higher risk environment because they have a lot of contact with people, or they're just somebody who just simply wants to test and help us know what the status of COVID is on our campus. So we do that. We also do symptomatic or exposure testing. So if somebody has symptoms, they know they've been exposed, they can come in, they can be tested right on campus. And if we need to, we have the ability to send the test to Spectrum Health to confirm the results. And those tests are covered completely by the university at this time. It's important for us to remove barriers and encourage people to be tested. My joke all year long, and Kate in particular can attest to this because it comes up all the time in conversation. If it's a runny nose, it may be COVID. So get tested, and it's really easy. They're quick tests, and it gives everybody peace of mind. So as students and faculty and staff are on campus, we ask that they complete their self-assessments any day that they're here. The assessment helps us to understand the health of our community. As people report symptoms or if they report an exposure, the self-assessment will immediately tell them what steps they should take, whether they need to self-isolate. It'll give them a link to schedule testing if that's the recommendation. It'll give them links to who to contact in housing or in employment if they're a student employee. So we try to provide that information as quickly as possible so that they get their questions answered quickly. The self-assessment then also triggers for us the need to reach out and provide some additional information and support. So the university has what we refer to as the COVID assessment team. It's a team of nurses, and they will reach out to anybody who's tested positive or had an exposure and provide that information on isolation and quarantine. They will talk to people who've tested positive to try to identify that source of exposure so we can identify if we might potentially have an outbreak starting, because we want to certainly identify those early and try to reduce the number of cases. Then we also make sure that we assess for symptoms and see how people are doing. And then we'll find out about their contacts and who the people that are close contacts and follow up with them, determine if they're having any symptoms, what their vaccine status is. And of course, no symptoms and fully vaccinated means no quarantine. If they're having symptoms or if they're not fully vaccinated, then we'll provide the information on quarantine. Like I said, during these calls, the nurses, also find out just how the student's doing, and they answer any questions that they possibly can. They make sure that they have the number not only for, again, housing and student affairs, but that they have the numbers for our COVID assessment team, as well as the Spectrum Health COVID Resource Center. So the Spectrum Health Center is an arrangement that we developed with Spectrum Health last summer to support all of our COVID activities, that's a 24/7 call line. So if a student just has a symptom and they're not sure that it's COVID or should they be worried about it or whatever, they can call that in at any time. For those who might be a little bit more concerned or might have some more significant symptoms, they can ask to talk to the nurse. The nurse call line is always there. They can assess the situation, provide some direction to the student. We also have them, Spectrum will reach out and remind people if they've got symptoms to, remind them to schedule a test if they haven't done so yet. And it's a nice resource that's very readily available for people. So for those who test positive, they need to isolate away from others for 10 days. Somebody who's a close contact, again, who either has symptoms or who isn't vaccinated, they need to quarantine. Right now, the quarantine guidelines are a minimum of 10 days if they don't have any symptoms. Sometimes it goes up to 14 days, depending upon if there's symptoms or other situations. For students who live in the dorms, once we identify that they need to isolate or quarantine, then they are moved into an isolation or quarantine room. Anytime that this is necessary, that we ask a student to isolate or quarantine, there's an entire communication flow that happens with housing and student affairs that helps the move happen as quickly as possible, make sure that we have food and any other support services set up for them. We do a very generic notification to the faculty so that they're aware that the student may need some additional support, maybe joining via Zoom rather than attending a class in person, may need some extra time to do an assignment if they have significant symptoms, those types of things. And then we also have 2 individuals on campus who also reach out to students just to make sure that they have anything else. There may be other situations we're not aware of with a student, and we want to make sure that we provide any support that's needed. So we've tried to take our COVID resources and try to make them a complete wraparound so that questions are answered, anxiety gets reduced, and students get what they need to continue their academic progress with as little disruption as possible during these really kind of crazy times. So, and that's my piece.
Thank you again so much for attending this Q&A session. And we truly look forward to seeing you and your student this fall. I will leave it to any of my colleagues if you'd like to say any parting words.
Feel free to reach out to any of us via email or call our office number if you have any follow-up questions. We'll be happy to help. We understand it's an unusual time where typically we would have all been in person to have these conversations and getting to meet your students as well. So it is a different time frame, but we are ready for your students to return to campus. We are excited, and we're here to help them have a really positive experience and help them along the way. So thank you for attending this session. And if we do run across you on the campus in the future, say hi.
Thanks, everyone. Have a good evening.